everybody, and welcome to another episode of the Serdentity podcast. I am your host, Elizabeth Dooher-Anthony, and tonight I have with me the great Dr. Felix Liao, whose book, 6 Foot Tiger, 3 Foot Cage, should be required reading for all dental people. And I'm just absolutely thrilled to have him here tonight. And we're going to talk about Serdentity, but we're going to talk about his new treatment for oral health disease, and it's using epigenetics. So that's pretty darn exciting. So hi, Dr. Liao.
Hello, Elizabeth.
So, Serdentity is a combination of serenity and dentistry. And if we want to stop traumatizing our patients, we have to start approaching oral care, dental care, from a different angle. And that's why I love 6 Foot Tiger, 3 Foot Cage, because it's a completely different way to look at the causes of dental disease. And when I speak in my talk about roots of dental trauma, I teach my audience, these are the things you need to look for when you're looking at your dental patients. You know, you see their name on the schedule and it makes you think, oh, but then when you look at them, look for this, look for forward head posture, look for the flat upper lip, look for signs of mouth breathing. You know, these people, maybe their behavior is a real challenge, but there's a pretty good reason why. And that allows us dental people to be proactive in approaching our dental patients rather than reactive, right?
You're so far ahead of your peers. It's not even funny. I mean, you really should be really proud. Your mom should be really proud of you for having gotten this far. You're way ahead of so many doctors I know.
Oh my gosh, thank you.
Yeah.
Well, and it's ultimately self-serving, because as I learned about all these things, my patient interactions went better. So when it goes better for me, it just, at the end of the day, I'm not exhausted and frustrated. And you hear all this talk about burnout. Well, that's why people get burned out.
Oh yes,
They're
I think
so frustrated.
when there's joy at your work, you'll never get burned out. I've not heard of anyone who got burned out by joy.
Right. I'm just too joyous, I can't stand it. So yes, so let's talk about this treatment that you have. It's amazing.
Yeah, I wish I was at the start of my career, because this is so much fun. And patients love it. First of all, can I put on a few slides?
Absolutely.
Just to illustrate, okay?
Mhm.
So, epigenetics is a big fancy word that's really more about how to get genes to show up and in full, not in part. Okay. So how did you end up with, let's just say that, of people who had braces, right?
Oh yeah, me.
Yeah, you've had people who have had dental reconstructions, implants, failed
Yep.
root canals. Okay. Well, what happened? How about people who need clear tray treatment? All these things where they mail the clear trays to your house and you straighten your crooked teeth and voila, you're joyous, right? That's what the commercial says.
Right,
But
exactly.
why do you need it in the first place? Okay.
Right.
So I want to just introduce a couple of concepts to you um, that is illustrative of what um, epigenetics could be. So epi means on top of. Okay. Actually, I have a slide here that defines exactly what epigenetics is.
I see Weston Price in there, and you and
Oh
I are on
yeah,
the same page with
you
him.
spy that real well.
He understood 100 years ago what the problem was.
He is the original oral systemic dentist.
Yes, he is.
Yeah. All right. So let me just go through this first as an opening example.
Sure.
So here we have a young man from top left to, let me just change this a little bit so you can see that. Yeah. Can you see this okay?
Yes, sir.
I'll just go to full screen. Probably easier. Yeah, there we go.
Mm-hmm.
All right. So this is the same patient, same person.
Mm-hmm.
Okay. Top left is where we start. We gave him this combination of treatment. This is just like a icon representing the epigenetic approach. Okay.
Mm-hmm.
From here to here to here, it's about 6 months.
Mm-hmm.
From here to here, it's about 2 more years.
Wow.
Same guy, same set of teeth. We did not put any braces on.
Mm-hmm.
Nothing. Okay.
Mm-hmm.
So this is what I mean, and this is what Elizabeth means by epigenetics. So here we have the same thing. This girl came to me with a referral from mom and say, hey, I want you to look at my girl. And this is what she looks like 3.5 years later on the right.
Amazing. Look at how caved in her maxilla is.
No
and
braces.
both of her jaws.
Yeah, no braces, okay?
Right.
So what happened here? Well, this is what epigenetics can do. In fact, epigenetics is really about how do we get to our optimal gene expression for this part, okay? I mean, for this part is my application of the definition of epigenetics. So let me find that for you because I really did set this up. But I have such a long introduction, I got lost in the intro. Okay, so here we go. Epigenetics, according to CDC, is the study of two things affecting how genes work. Those two things are 1, behavior, 2, environment.
Yes.
So now I thought, well, what if we were to turn this for the mouth, become fully developed, to full genetic potential? What would that be like, right? So this is where the fun starts. So I want to just back up a little bit here and show you that Western A. Price actually did go out and find people that naturally formed, I call them best faces. So
yes,
to all my patients, I tell them, I don't care where you come from. I don't care what your skin color is. This is the mouth I want you to have. Room for all the teeth to line up straight, every tooth, okay? Line up straight in your maxilla and your mandible. When that happens, your tongue will have enough room to stay happily in the mouth and not have to block your throat to cause sleep apnea, okay? So, and with good night's sleep, because your airway is not blocked, as a result of fully grown maxilla, then you'll have all these good things happening to you.
Yes.
Broad faces, wide arches, no crowding, and therefore less susceptible to perio, less susceptible to gum cavities, balanced head and jaws, and radiant natural health. And guess what? These people are naturally happy.
Right, naturally joyful.
Yeah, okay. So this is Dr. Weston A. Price's work. He was the chairman of ADA Scientific and Research Committee, Research Council, back in his days. And here's really the important starting point for everybody to recognize. By Sally Fallon, who founded the Weston A. Price Foundation. I recommend everybody who was interested in dental facial growth and good airway to go there. Weston A. Price Foundation. So she provided this wonderful summary of Dr. Price's work. That is, if you have wide dental arches, then you have straight teeth. And then everything from your cranium, your skull, or home of the brain, to your skeleton, to your eyesight, to your hearing, to your internal organ, down to childbirth, everything will work well. Conversely, if you have narrow dental arches, you will have crowded teeth and compromised everything from the maxilla down.
Mm-hmm.
Okay, so gene expression is all about how to get to this point from conception or from birth. So here we're seeing that this arch, okay, is fully developed, and later on I will show you what her case looks like.
Mm-hmm.
Because interestingly, she started braces, and as soon as mom heard about epigenetics, Elizabeth, she said to the orthodontist, who happens to be her own best friend.
Mm-hmm.
And so she sent her daughter Zion to her best friend, the orthodontist, and she said to her, to the orthodontist, I want you to take Zion's braces off. And the orthodontist was incredulous, and she said, why are you doing that? All her classmates are having braces then. Like it was a rite of passage kind of ritual. I mean, that's how degenerated it is. Okay.
Yeah.
We are supposed to be like this.
Yes.
And instead, we're ending up like this as a norm.
Yeah.
Okay. So crowded teeth means choked airway.
Yep.
Guaranteed. Okay. So this young lady, I'll come back to this other case shortly. The one whose braces got taken off. This one had the misfortune, remembering this, okay?
Mm-hmm.
Wide arches means everything works well in the body. Narrow arches means everything else pays a price.
Mm-hmm.
Down to depression, behavioral problems, and difficulty with childbirth. Well, by the time her parents read my book, she had already gone through extraction orthodontics. Yep. She had already gone through extraction.
Yep.
Orthodontics.
Yep. So they took out her
pair of premolars.
Yep.
On the top. Okay.
Yep.
Now, interestingly, they didn't do that on the lower. Now, what kind of a result is this? That you have straight teeth as a result of extraction, and look at what is going on here.
Yeah.
Total mess. All right. Well, the tongue is now a respiratory organ. All right.
Mm-hmm.
So this space between the maxilla and the mandible really is vital to your sleep and your learning and your energy levels. So back to this thing here, just because we're here, back to this young man. When we straighten out his bite, his scoliosis got better.
Yes.
All right. So don't ever let anybody tell you, oh, that's just teeth. Oh, that's just braces.
Right.
No, it's the whole body. There's not
Absolutely.
one bone in the body is not connected to the rest.
Right.
Yeah. Okay. So let me bring you fast forward to that young lady. I am fond of that. And I'm so glad you asked about this so that we can start with that. So this is Zion right at the time when her braces got taken off at mom's request. Okay. Now, understand, mom was a naturopathic doctor in the Philippines. She came to America, went through dental school, and got her degree. And in dental school, she met her orthodontist. And as a result of going with Dr. Felix's epigenetics instead of orthodontics, Zion went from here to here in 2 years, and from here to here.
Yeah, look at the difference. You cannot see. She's got all those two black triangles on the lower left photograph. You can see that the the arches are narrow.
Yeah.
And on the right-hand one, look at how beautifully the teeth, look at the flare of that, her maxilla. That's amazing.
Yep. This is what epigenetic is. Fuller gene expression. It will lead to better face and wider airway. And from there, it's like unfair competition with the rest of the classmates and the rest of the field. Okay. I'll explain to you what that means in 6 slides. So this is where she first got started. And look at what happens 10 months later. Okay. And that's all because we did this and we gave her a bone building diet, which we described earlier in the slide deck. But just remember that, oh, well, I think I have it there somewhere. Hold on.
Her entire face is different. Her nose is different. So you increased her lower, her philtrum is a little bit longer.
Yep.
And so she's got, her lips are naturally sealed. Wow.
Good eyes. You make a great detective. Clinical detective. Okay. So my position is do epigenetics first, then follow it up with braces if necessary. Don't go with braces and ignore the foundation that is the jaw and the airway.
Right.
Yeah. Okay. So we use all this treatment, by the way, was done not only without braces, it was done without shots, without drills,
Yep.
without exercise, okay? And nothing like a so-called healthcare you get at a dentist or pediatricians or medical doctor's office or a hospital. So at baseline, her presenting complaints were sleep disruption.
Yep.
And we asked her to rank every symptom here on a scale of 0 to 10.
Yep.
And it was 8, headaches was a 9. And look what happens in 10, 20 weeks time.
Yep.
It went from 9 to 0.
This is the same thing with their orofacial myofunctional clients. These
Exactly.
are the same symptoms that they present with.
That's right. Okay. Sleep disruption went from 8 to 1, snoring 8 to 2. She's training to be a soprano. So she had a lot of stress to her singing with the braces on. Okay.
Oh, yeah.
Now it's down to 2, and her fatigue went from 10 to 2. All right. So when we add up all the scores, pre-treatment was 54 out of 1, 2, 3, 4, 5, 6 symptoms. Okay. So average was 9. Okay. Now, 20 weeks later, those same 6 symptoms went down to 11.
Yeah. Wow.
The difference is 43. Divide 43 into 54, you have a 80% improvement.
That's amazing.
Okay. So this is how big the mouth is in whole body health. Now, here's another thing. This is medical. This is semi-dental, semi-medical. This is medical. This is medical. This is medical. And this is medical.
Right.
No drugs, no surgery, no pain, no braces. Where are you going to get this kind of result?
Right. Especially without surgery. Well, you know, our culture, we're surgery, medicine oriented.
Yep. And look there's a close-up, 2 years. Just the appliance and the bone building diet. And there are certain things we, make sure that happens, such as nasal breathing and bone broth and green smoothies. Okay, so the body has what it needs to grow the maxilla.
Yes.
You don't just move teeth like box cars on rails, as in braces, and expect great face to show up. You might have straight teeth, but as soon as braces come off, guess what happens?
Yeah.
Relapse happens.
Of course.
So when we do the epigenetic method, we can grow airway, okay? 50% in volume in her case in 2 years. And we had just short of 100% gain in minimal cross-sectional area where apnea or the collapse of the airway happens.
Mm-hmm.
You went from here to here. So white and blue means the white end of the color scale.
Mm-hmm.
Okay. The more you move toward the orange, red, and black end, the more the 4-lane highway becomes one.
Mm-hmm.
Right. So as a result of this, she got a 4-year scholarship to a college of her choice.
Amazing.
$56,000 a year. That's what this airway can do. That's what this mouth can do in return. So all of that is based on the mother's choice to do this instead of braces. So this is what epigenetics is about, in answer to your question. I hope that did it.
Yes.
Yeah.
And you know, this is so fascinating, and it's so encouraging, because this is what we need to stop, you know, looking in people's mouths and wanting to fill in all the little holes. We
Nope.
need to ask ourselves, why are those holes there?
Yeah.
And, you know, so much of it has to do with, you know, well, it's, you're not flossing enough. And it's so much more than that. It's, you know, the biome, what, you know, all these bacteria, we're feeding them really well. They're living the life. They got the life of Riley in there. They're having a party, and they're, you know, and we're feeding them with all this sugar. We're mouth breathing. And is it any wonder that things break down?
When you have a choke zone, you have oxygen deficiency,
Yeah.
and certain bad bacteria thrives on low oxygen environment.
And then they get in your bloodstream, so your whole body is overrun with these bacteria.
Yeah. But none of this happens without a bone building diet. This is
awesome.
difference. This is a big difference between the traditional dentist's favorite mechanical approach, right? What's mechanical? Well,
right,
a drill,
yep,
braces, clear trace. They're all mechanical devices.
Yes, that's what
Where is the
we
biology and where is the physiology, right?
Right.
Well, I want to just skip to one side really fast. It's kind of a fun way to check things out, because let's see, where did it go? Oh, I think it's at the beginning. Sorry, I rearranged this 10 minutes before I went on. I forgot I put it
Right.
in.
Oh my gosh. I can never find the slide I want when I'm looking.
Here.
There
Okay.
it is.
Okay.
Yes.
So Paul Chek in 1993 wrote a paper called Totem Pole Hierarchy of Survival Reflexes. Okay. So guess what's on the very top?
Breathing.
So he used a totem pole as a way to rank which reflexes are most important for whole body health.
Yes.
I listed out for you here. Breathing is number 1, eating is number 2. Then you have to be able to see so you can get the food, right? You gotta hear so you hear the prey come in. Turn your head, you see what's around you. Digestion, once you get the food, you can eat it and have to digest it. Once you digest it, you can sleep and you have enough energy in your tank, then you can talk about reproduction, right? When you have energy in your tank, guess what? You can go hunt again, right?
Yes. Yes.
Yeah. So I love that. I want to come back to this thing here. And notice how it echoes this summary slide. Okay. And so actually the mouth is the energy provider for the rest of the body. So this diagram as mine is simply illustrate through 3 colors, 3 different systems that the mouth is on top of. Yep. One is air breathing in green. All right. The other one is circulation. and the other one is digestion. All right. These three things is what provide energy to the body.
Yes.
And the mouth supports whole body health through these functions: alignment, breathing, circulation, digestion, energy, and sleep. Now, we're not going to have time to talk about everything, but
Right.
pain is from misalignment. Fatigue is from breathing and sleeping. Okay. So pain and fatigue is the leading symptom for a mouth that is structurally not fit to support whole body health. So there's a whole syndrome that come out of that. And here's what my patients have told me after they go through the treatment. An impaired mouth I define as a deficient jaws and choked airway. A 6-foot tiger in a 3-foot cage. Okay. You can still eat, you can still drink, you can still talk, but you cannot support sleep and alignment with this. Now, when that happens, all of this happens right here. By the same token, when this is fixed so that the tongue is no longer a tiger blocking the airway, the tongue is just the tongue happily working in between the two jaws to support whole body health, then all these problems also go away. Okay, so here I have a video. This gentleman was very kind to share his experience with us. Want to see it?
Sure.
Hi, I'm Sean, and I use Dr. Layout permission to use this for educational purposes.
Now, he had a diastema before he started.
Mm-hmm.
That space between the two front teeth.
Maxed out with the top, and we're getting a new one. And I've been treated with the appliance since October of so that yes, roughly 11 months. I got it early in October last year. And I wanted to report one benefit, which is it's had a beneficial erectile effect. Most notably, I wake up a lot at night with nocturnal erections, which is something that rarely, if ever, happened before I started using the device. But it happens frequently now, and sometimes multiple times in a night if I wake up multiple times. So one of the benefits, I'm pleasantly surprised, and I wonder maybe if they're advertising the wrong things during football games.
What else have you noticed besides this detail?
I can run with my mouth closed. I mean, well, actually, before I started all of this treatment, it was hard for me to even close my mouth. But now I can close my mouth and breathe through my nose. And while I don't run as fast as I do with my mouth slightly open, I can still, today I ran 6 miles in 55 minutes with my mouth closed.
Wow, that's very impressive. Your lung capacity and your respiratory efficiency is much better.
Yes. You don't inhale any bugs that way. Yes.
All right. Okay, so how he got there is not because of taking some little blue pills or testosterone supplements, okay?
Right.
It's because we opened up his airway from 123 here to 226 here. That's exactly 2x, twice, double the minimal cross-sectional area, okay? So that's why his circulation is good, and that's why his running efficiency is good, and that's why his hormones are working perfectly, all right? And we also have, speaking of reproductive system, this new mom who had 4 miscarriages before. Her partner sat in my class, and she said, "Oh, a light bulb went off in my head when Dr. Liao was talking." And we should give Emily a epigenetic appliance to open up her airway. Maybe she wouldn't be miscarrying. Well, guess what? It worked.
Mm-hmm.
Here's the evidence. They kept very good track. So this was 6 months.
Mm-hmm.
She went from this airway at 77.4
Mm-hmm.
millimeters to 77.4 here to 206.
It's amazing.
So 737 to 208 rather is 2.7x. And you can see that plainly right here.
Mm-hmm.
That is the difference between miscarriage, where you don't have enough nutrients going to the uterus and the baby, or you got a new family. Yeah. So this is joy, and this is physiology, which is how the body works.
Yes.
The mouth actually controls how the brain functions, how the heart functions, and how your quality of life is up or down based on whether or not you live with a 6-foot tiger in a 3-foot cage.
Yeah.
Yeah. Yep. So this is what you want to end up with, regardless of your ethnic background. And I would maintain that when God puts tooth in every one of us, he intends for every tooth to have enough bone volume to support the roots. All right. So it's kind of like when you get on an airplane, you bought a ticket, right?
Mm-hmm.
You have a seat, right? Now, when there's not enough bone volume, this is when you have crowding.
Mm-hmm.
Okay? And so instead of just lining up teeth using braces mechanically, we should think physiologically on why the crowding happens in the first place. This will be foundational, right?
Yes.
So when we look at the face, when you look at somebody's face, like this guy here, you look at his face, well, on the underside, okay, is the maxilla and the maxillary teeth. We've all seen older people who have dentures. They take their dentures out and the whole face collapses.
Just collapses, yes.
Right. Okay, so volume, the convexity of a face is determined by jaw growth and the presence of teeth. All right. So this is not just about cosmetics. This is about wrinkles. This is about how long you live, what your quality of life is, what your fulfillment level is.
Yes.
If you're fighting to stay alive every night when you go to sleep, you're not going to excel at work, right? If you do, you're going to burn out really fast. I want to show you a example. Well, actually, I have several examples. Okay, so how does epigenetics affect energy, sleep, and hormones? Right? We talked about hormones already.
Yep.
So here is someone with low back pain.
Yep.
At age 61. Okay, 61. That means that she has suffered for 50 years. And during that time, her dentist took care of her teeth, okay, but they couldn't connect the dots to her low back pain.
Right. No.
I'm telling you in no uncertain terms that the most common improvement besides sleep and energy level is improvement in the neck, shoulder, and back pain.
Well, because once it straightens, once you have enough air, the body doesn't have to compensate anymore. People are so twisted up. They have no idea.
Yep. So notice how the lower front teeth are crowded.
Yep.
So here is one useful rule. Anytime you see crowded lower front teeth, you can surmise, just like Sherlock Holmes, that the upper jaw did not grow sufficiently.
Yes.
The upper jaw failed to reach its full genetic potential.
Yep.
Even though the teeth does not look terribly crooked.
Right.
Well, the deciding factor is this one here, okay?
Yep.
I mean, the telltale clue is this one. So we say that lower is like a foot, the upper is like the shoe.
Mm-hmm.
The shoe stays stationary while the foot moves. And guess what? When does the toe have to scrunch up?
Right. When it's pushed to the front of the shoe.
When the shoe is got a Prada toe box.
Yep.
Right? So instead of a nice U-shaped arch, you got a Gothic arch.
Yep.
Right? Now, top left is baseline. Then we gave her the treatment. Here's the appliance in 10 months. She came back looking like top right.
Mm-hmm.
This is what epigenetics does. All right? Just this much change produced this. I hardly recognize her. That's
Yeah,
how
look at
dramatic
wow,
it
her
changed.
yeah, her under her eyes she just looks more vibrant.
Yeah.
And her eyes, the cant. So her in the left picture, her, the corners of the eyes are a little bit canted, and in the right picture, they're pretty much straight.
Yeah.
It's and yeah, and her philtrum is longer, and her yeah, and her mentalis is nice and relaxed.
Yeah.
Yeah. Did she have extraction retraction orthodontics?
No. But she looks at you with her left eye instead of both eyes
Yeah.
in this picture. Okay. And so here it is in 10 months, and I couldn't believe it. When she came back, she wanted to close here.
Yeah.
And we're working on widening her posterior maxilla now.
Mm-hmm.
Okay. But you can see just in 10 months time how much difference that has made.
Oh, yes. You can see the vitality.
Yep. And so I asked her what her presenting complaints were to fairy godmother so that, she could wave them away.
Mm-hmm.
First one she said was lifelong nausea. And I kind of, wonder to myself, wow, how does the mouth help lifelong nausea? I mean, she's
Mm-hmm.
been to her medical doctor for 50 years, right?
Right.
So they have not been able to help him. That's how she mentioned that in my office, right? And she had poor sleep, also lifelong, very hot flash. And I love this fourth one, burping like a sailor.
Right.
Okay. So all of these were 10s. She also has sciatic pain. She had gut dysbiosis, like you were mentioning earlier.
Mm-hmm.
She clenches the jaw. She's got stuffy nose. Well, every one of these in 10 months time went down. But nausea and burping, I mean, before I met her, I wouldn't have said, oh, I think there's an oral contribution to it, right? We tend to write them off as, oh, that's in the medical doctor's realm. You got to take drugs, you got to take, something fizzy, whatever, supplements. But no,
Well,
get the mouth right.
yes,
Sleep
she
right.
can chew.
Yeah.
When your tongue is out of function, right? So you have to eat soft things and you hardly chew them. So and your mouth breathing. So you're taking in all this air while you're eating, and that creates that gas.
Yep. So the lifelong nausea went from 10 to 1.
That's
I mean, I was
really
shocked.
interesting.
Okay. Burping like a sailor, 10 to 1. I was shocked. all right? Even very hot flash got better, all right? And I'm just a dentist serving as an airway
I'm just a
mouth.
dentist, right?
Yeah, okay. But something is missing. So this is what epigenetics does. It's not just a surface appearance, okay?
Mhm.
It's a form follows function
Always.
and health follows form. So a
Yes.
better looking face means better health through wider jaws and more open airway.
Absolutely.
So we had this published in the Journal American Orthodontic Society. This is a journal read by dentists who do orthodontics who are not orthodontists,
Mm-hmm.
right? So in the same article I submitted,
Yep.
here's another lady who had back pain, okay? And this is her neck. And guess what? The mouth has a huge contribution to neck dysfunction.
Yes.
She had been going to Thai massage and chiropractors all her life,
Mm-hmm.
practically since she started working. Well, why did she have to keep going back?
Right.
Well, look what happened after we got done.
Wow. Oh my
Neck
gosh.
straightened. That's right. Okay, the neck straightened. Epigenetic. When we straighten the mouth, the neck straightened. And she didn't have to go back to the chiropractors as often.
Wow.
All right. So not the same case, but I want you to see how the deviated septum also,
Mhm.
okay?
Yes. Look at that.
Yeah, this is the first documented case where deviated septum straightened, okay? And you notice that the molars were end to end.
Mm-hmm.
Well, we have healthy buccal over jet now. The
Mm-hmm.
lingual cusp tip is in the center of the occlusal fossa,
Yes.
right? Yeah. So this is an important thing for a lot of people. Dental patients have medical issues.
Mm-hmm.
Medical patients have dental issues. Okay. So dentists really need to know how the mouth contributes to the rest of the body and how the rest of the body contributes to the mouth. All right. The same thing happens with medical doctors. They need to know how impaired mouth structures can impair the patient's medical health and medical treatment. And what I have found is that, well, I'll show you that shortly. But let's just go through this case because we're here. So again, we start from top left as pre-treatment.
Yep.
This is
Oh,
what
classic. Smushed all in.
right, okay? And this is what happens in 2.5 years, okay? And he was ready for phase 2 orthodontics now. You
Mm-hmm.
have to widen the foundation, okay?
Yes.
And this is what his wife has to say. There's no better direct observer of the patient than the sleep partner.
Hi, I'm Shannon Martin.
Yeah.
I am the wife of one of Dr. Leal's patients.
Okay.
And over the last 9 months, or is it a year, he's been using Dr. Leal's process and program to straighten his teeth out and help him have better breathing and healthier life. So what I've noticed is that he is sleeping better. He's not waking up in the middle of the night as often.
Really? Okay.
He's not having, he used to flail a little in his sleep, which is not doing waking me up, of course, which I don't like.
Okay. Okay, so you can tell that firsthand, right?
Yes, he's also had a better memory, which is really important because, you know, we run a company and that is very noticeable to me.
Yeah.
Otherwise, I mean, he's got a lot, he's not waking up and like coughing himself awake, like he's not choking. I mean, he's not snoring as much either, which is nice too.
Wonderful. Well, thank you for sharing your experience with that.
Yeah, thank you.
Thank you.
Bye.
Okay, so American Academy of Sleep Medicine says, if the sleep partner observes that the patient stopped breathing for longer than 10 seconds, you don't need a sleep test. You got a medical diagnosis right there.
Right.
It's OSA, all right? So this patient had a 90% gain in 30 months. No pain, no shots, no drills, no surgery, no drugs, okay? So sleep apnea was witnessed by his wife. It went from 10 to 0. Teeth grinding using the Niger, 10 to 1. Crowded teeth, 10 to 0. So tired and anxious, 10 to 3, because he owns his own company.
Mhm.
Pains in the neck and shoulders and back, 10 to 2. Wake up refreshed 0 days a week, 10 to 0. So you add up these numbers, it's 6. You add up these numbers, it's 60. That's a 90% improvement.
Yep.
All right. So across medical, dental, and mental symptoms, 90% gain.
Mm-hmm.
No drugs, no
No
shots.
drugs. Nope.
No. And so here is the objective comparison of his maxillary arch pre-treatment, and here's post-treatment. He went from -6 to +2. The gain is 8.
Wow.
He went from -1 to +5. The gain is 6. Okay.
Mm-hmm.
Now, in this pre-treatment, we notice that -6 on the premolar segment on the maxilla versus -2 on the lower. Which one is smaller? The maxilla. Well, we
Mm-hmm.
said the maxilla is the shoe and
Mm-hmm.
the mandible is the foot. So which one needs to be bigger?
Yeah, the maxilla.
Yeah. Well, here it isn't. That's why he had the problem.
Right.
Now look at this, +2 and +2. They're even now.
Mm-hmm.
+5 and +3. Guess what? The shoe is now wide enough for the foot.
Right.
Yeah. Okay. So that's why he had the improvement. So we published this in the Journal of American Sleep and Breathing Academy. You got to see this impaired mouth syndrome first.
Mm-hmm.
Okay? You need to see how the mouth contributes to airway and sleep. So this is one of the next slide is probably the most consequential slides I've ever come across in sleep medicine research. This is out of Stanford Sleep Center, the world's premier sleep research center.
Right.
Conclusion was that pediatric sleep apnea in non-obese children is a disorder of oral facial growth.
Yep.
That means your jaw failed to thrive, your gene failed to express the full potential. Okay.
Mm-hmm.
So let me ask you this. Of all the doctors you know, who is trained to take charge of oral facial growth?
Us.
Yeah. Yeah. Myofunctional therapists and airway mouth doctors.
Yes.
All right. Everybody else still into clear trace and braces and myo munchies and what have you.
Mm-hmm.
Okay. Now, this is what led patients to the orthodontist in the first place. Most general dentists just throw up their hands, right? Oh my God, go
Well,
see the orthodontist, right?
So
But
are those retained primary teeth?
yeah. And what they don't ask is, well, how come things are so bunched up,
Right.
right? And what are the consequences of bunched up teeth?
Mm-hmm.
Well, this is the consequence, okay?
Right.
You can see the hourglass choke zone right here.
Right.
Anyone who sleep with this thing is not going to thrive.
Right.
That makes sense, right?
And the low tongue posture also.
Yep. And guess what? That is a very important connection because if you just take out teeth and close
Right.
the space, what's going to happen to this choke zone?
Right. It's going to get more choky.
You got it, but you know what? Extraction, retraction, orthodontics is being done to this day, right? And
I
left.
know it's,
That's why I have to talk about this, okay?
yeah,
All
no,
right,
I
so-
get it.
So this patient reached out to me in the middle of the pandemic from the other side of the world. She read 6 Foot Tiger, 3 Foot Cage. And can you help me? My pain is so bad. Sometimes I feel like wanting to kill myself because I didn't see any way out.
Yeah.
This is the form she filled out online. Everything on the mouth side. So this is a dental,
Yeah.
and this is medical, if you will. Okay.
Sure.
So 0 is none, and 1 is yeah, I got it. She's got everything except cavities on the dental side.
Right.
Medical side, she's got everything except she doesn't have heart disease. She does not have pot belly or weight gain. And she's got everything else.
Right. Yeah. Wow.
Yeah. Okay. Now, in the mouth, she looks like this. Okay?
Well,
Can't breathe. I can't breathe. Okay. With the jaw made smaller with 8 teeth pulled for braces.
that's what I had.
Yep. So she had homeless bite for 25 years. She couldn't tell where her teeth should fit.
And look at this. Look at her tongue. Oh my God. Look at her tongue. Look at the scalloping.
You bet.
Oh,
So, she's got straight white teeth.
right.
Parents sacrifice and pay for it. So, but the patient is miserable.
Yes.
So is that a success?
No, that's
Well,
harm. We're not supposed to
well,
harm. Do no harm. We are
but
not
the-
supposed to be harming people.
By the orthodontist standards, at the time of debending, it was a raging success. Look how straight and white those teeth are.
Right.
Right? This is 30 years later. Okay.
Mhm.
So, I mean, we have the benefit of the hindsight. She
Yeah.
had TMJ pain for 15 years.
Sure.
And
Of course she
it was
did.
so bad. It was so bad that she wanted to kill herself.
Oh,
Okay. And so I recruited her family dentist and say, look, here's my program. Would you help implement it? So he sent me the records I needed. I designed the appliance. We shipped it to him, and he delivered the appliance. And she and I met on Zoom. I want you to see the face.
oh my
12 weeks
gosh.
later. Okay. And we more than double her airway volume and her minimal cross-sectional area.
Look at her. Look at her face. Look at the
Yeah.
vitality
Yep.
in her face.
Yep. And so we also measure her subjective units of distress. She went from 70 to 16.5, and that's a 74% gain. For someone who wanted to kill herself because of pain,
Yep.
this is pretty good.
Yeah.
Everything got better. Jaw pain,
Yes.
sleep, snoring, neck pain, daytime sleepiness, brain fog, or poor digestion.
Yeah.
Everything got better.
Mm-hmm.
Okay, so the mouth is part of the head, and people forget that the
Yes.
dentists are dealing with a part of body's command and control center,
Mm-hmm.
right? All I did was regrow the maxilla and the cheekbone grew.
Mm-hmm.
Okay,
Yeah.
her sleep improved, her airway widened, and same set of teeth.
Yeah. Same teeth.
We didn't even
Yeah.
do braces on them. Okay.
Right.
She's back from the brink of suicide. So we should look at the mouth as a crime scene. Okay. So crime scene investigation, we're going to look for impaired mouth. Okay. How many of these do you see every day?
Yep. Day in, day out.
Every day, but nobody's connecting the dots.
Right. And these are the patients that are can be labeled problem patients.
Yes.
Because they come in and they've been traumatized. they're expecting to be traumatized again. So they're defensive. They're coming in trying to manage the appointment, and then they get labeled rude. I had this rude patient, and somebody rants about it in a Facebook group. I'm like, no, this person can't breathe. Okay. They're trying to survive.
Yep. So I want to just walk you through a few more slides that can make a big difference in some of these people's lives.
Absolutely.
So I wrote a couple little pamphlets. They're 90 pages.
Yep.
If you're a good reader, and there's 71 slides, so there's practically a slide in every page. And so you can flip through this fairly quickly.
Mm-hmm.
And one is for children and one is for parents
Mm-hmm.
who are tired, fed up. So this, sometimes you cannot just do a appliance, right? You have to be able to tell this condition called hypothyroid.
Mm-hmm.
People who are hypothyroid, they're gonna have an oversized tongue. They're gonna have a pot belly. They're gonna have turkey wattles under their chin. They are going to have cold hands and feet. Their hair are gonna fall out in clumps when they take a shower. And guess what? They will have creepy weight gain. Okay, so they're just low energy because the thermostat is set too low.
Yes.
So I love this quote that I took from Dr. Jerry Tennant's book. It's called Healing is Voltage. What's voltage? Electrical energy.
Mm-hmm.
Okay? You need electrical energy to open up the cell membrane. So there's a door, and so nutrients can come in and waste can go out. Okay.
Yep.
Otherwise, it's like being locked in a prison and you have no water, no sewage.
Yep.
And no ventilation. All right. So he said, your body is like this cart. It's drawn by two horses. One is called thyroid, the other one is called adrenals. And this cart is you. The first one to go usually is the thyroid. After the thyroid conk out, the adrenals try to keep going.
Yep.
And pretty soon the adrenals conks out too. And now, look at this last line here. Now your wagon isn't going anywhere. Well, what does that mean? It means that once you get sick, you're never coming back.
Mm-hmm.
All right. So you just run on compounding interest on a downhill spiral. So here are two patients of varying ages, one male, one female. And this is their airway. All right.
Mm-hmm.
So the color scale is very obvious here. White and blue is a 4-lane highway.
Mm-hmm.
Right. Red and black is 1 lane.
Right.
So this airway is trouble. Guess what? He had prostate cancer and surgery.
Wow.
I wouldn't want to wish that on my worst enemy. Never
Mm-hmm.
mind. Innocent accountants. Okay.
Mm-hmm.
Here, she had 10 times his airway volume, but she's in her 40s. Okay. When these people go to sleep, they feel like this marmot.
Yeah.
They're confronting death. Moments before this marmot was lunch.
Mm-hmm.
For this box, okay? I mean, look at the body language here.
Mm-hmm.
Oh my God, I gotta die next
Right.
week. That's it. Okay. So that's why these people wake up tired.
Yes.
And instead of filling up their gas tank, they are depleting their adrenal tank. Okay.
Mm-hmm.
And so here's a book called Adrenal Fatigue Syndrome. And it talks about, and I quoted this from his book, the most common symptoms: insomnia, waking up tired. Guess what? That's what we deal with, right?
Right. Yes. Yep.
Headaches, no sex drive, chronic pain and fatigue, allergies. That includes acne. Remember that young man I showed you?
Yes. That's what I
Okay.
noticed. His skin.
Yeah.
I noticed
He
his skin.
got skin cleared up, okay?
Yep.
PMS, frequent colds, respiratory infections, blood sugar cravings, and swing, right?
Mm-hmm.
So when you don't get this diagnosed And or worse yet, you got diagnosed, you don't act on it. So you go downhill
Mm-hmm.
night after night this way, and you end up with all these problems. It's like this.
Yep.
You go from youth where you can get away with murder, go party all
Mm-hmm.
night and go to class and ace,
Right, right.
right? Okay. Then you know, go to grad school, you come out with a degree, you come out with educational debt, you buy a house, you start a family, and boom, pretty soon you find yourself on a high-speed hamster wheel.
Mm-hmm.
You get tired, and you have those narrow airways.
Yep.
Now you cannot make a comeback toward the top of the hill anymore.
Right, right.
You're out of this yellow zone where, you know, your stress demand is high, but you're able to do it on the left half, but not on the right half.
Yep.
Once you go down this hill, now you need a vacation after you come back from a vacation,
Mm-hmm.
right? So this is where people start, you know, going to the pharmacist to say, hey, you know, what do you
Yeah.
got for me? They start
Yeah.
going to the doctors. They start to look for answers.
Mm-hmm.
Now, if the doctor get it right, you can come back this way, okay?
Mm-hmm.
If the doctor don't get it right, you keep going this way.
Yep.
This is like severe sleep apnea. You're screaming, oh my God, I got 1 foot in the coffin already. I feel like I'm slipping,
Mm-hmm.
okay? So the question then becomes, how can you recover with an empty tank?
Right.
How do you get back to the top of the hill, which requires energy, right? And the other question is, okay, before patients slip down the hill far enough to end up with CPAP, what are the clues that we can pick up and warn the patient before they're here?
Mm-hmm.
This is the ultimate prevention, right?
Right.
So I say that we need to start asking this question.
Yes.
What do you pay your doctor for? To put you on drugs? Or to shoot you up and drill your teeth? All right. To screw implants into your jaw, to strain your teeth with braces only to have them relapse later?
Mm-hmm.
Or do you pay your doctor to get your vitality renewed? Well, the part in blue is what we do.
Yes.
And none of that happens only with the appliance alone. Okay. We are on the patient's case every day of the week. This is like the turkey soup you take out of the fridge the day after Thanksgiving,
Mm-hmm.
right? It does not flow. It's gelatin-like. Why? Because it's rich in bone-building ingredients.
Wow.
Why don't we take that and help the maxilla grow? Okay. So actually, it turns out bone-building diet will grow not only the maxilla, it would help snoring, it would shrink the nasal obstruction and fix mouth breathing. It gives you beautiful skin on the face and all over your body, and you raise beautiful children, and a better face shows up.
Mm-hmm.
And you mitigate risk of killer diseases. Gut inflammation, the source of nearly all internal
Yes.
medical
All
illness.
disease.
Yeah, okay. So I fixed myself at age 62. I used to have a little bit of a wad here because my lower jaw was retruded
Mm-hmm.
because my maxilla was not wide enough. And so I ended up with an airway that was in the reddish black zone, 13.6 cc in volume. And after the treatment, I have more of an angle here now. I have a class 1 resizal relationship and a facial profile, and my airway volume went to 28 cc from 13. I more than double my own airway,
Mm-hmm.
61. Okay. So there's hope for the rest of mankind because God is very kind and the body really wants to thrive.
Yes, it
Doesn't want to
does.
stay. Yeah, it doesn't want to stay stuck
No.
in that 3-foot cage. Okay. So I hope I have contributed something to your audience's understanding, we have part of your interest right here. Let's
Mhm.
make proactive health. Okay. And with best face comes better health.
Absolutely.
Okay. Before we wrap up, do you have any questions for me?
Yeah, when can I come and see you?
Okay. Well, here's how you reach me. And those of you who are interested, you can just, here's my email, the
Mhm.
best way, because when I see patients, I don't answer my calls. So my website is Holistic Mouth Solutions. This is for healthcare professionals. For non-healthcare professionals, I have a private practice in Northern Virginia. I see patients 2 days a week. I teach and consult the rest of the time.
Amazing.
All right. So I just want to play this for you because it makes me happy. I hope
Okay.
it's you too. Okay.
Okay. I'm not really hearing anything.
Really?
Yeah, no.
That's too bad.
Yeah.
Oh,
Oh,
well.
well, thank you so much. And I love that you understand what I'm getting at.
Oh,
And
you are brilliant. You
oh,
are brilliant beyond description for someone who came out of hygiene school and were taught how to scale teeth. Uh, you have evolved like 95% of the doctors have not. I'm talking about medical, dental, and psychiatrists combined.
oh my God, thank you.
Yeah.
And I gave my course and I talk about you. I talk about your book and I show them. So, everything I was saying to them is basically what you said, smushed down.
Yes.
So it's so important. It's so important for dental people to understand these things.
Think of a mouth as an accordion.
Yeah.
You can either stretch it in all three dimensions, or you can squash it. And the one that's fully expressed genetically will have best health, and best face.
Mm-hmm.
The ones who are squashed to varying degrees will suffer consequences.
Right.
It's that simple. And now we have ways to basically re-blossom the flower. I like to say that gene expression is like a garden hose to the garden, okay? Except in the case of crowded teeth, there's been a foot on the garden hose.
Mm-hmm.
So
Yeah.
that the jaw didn't grow to the full size, right?
Mm-hmm.
So now all we need to do is what?
Add water. Take our foot off the hose.
Yeah, recognize there's a foot on the garden hose and get off it. Okay? Then gene expression is going to happen.
Right?
Sometimes 50 years too late.
Right. Well,
Happen.
Better late than never, but that's why it's important. I'm glad you're talking about kids, because if we can get to the kids, they can have a better life.
Your Child's Best Face is a skinny little book for all parents to read.
Oh, well, I'm going to make sure I recommend that as well. Yeah. Listen, it has been an absolute joy speaking with you and an honor. And I hope we get to meet in person. And I'm going to give you a great big hug.
Thank you. And it's a treat for me to converse with you at this level too. Thank you.
You're welcome. So I'll see you again, I hope.
Okay.
All right. Have a great night.
Thank you too. Bye-bye.
Bye-bye.